live now then.
Morning everyone, welcome to this week's staff brief. I'm Paul Robinson, I'm the Chief Executive here at Sherwood, and today I've got with me Sally Palmer, who's our Nurse Consultant for Infection Prevention and Control, and Vicky Malia, who's our Head of Culture and Engagement. Just before we talk about all things masks, social distancing and national staff survey, I just want to cover off a couple of things that were raised on last week's brief and give some answers to the questions that came in. And by the way, ask your questions all the way through today, and we'll pick them up at the end after Sally and Vicky have spoken. So first question last week that was left unanswered was around the electronic timesheet system and when that will be implemented. So Pay Services will be introducing a new timesheet system for employees that are not currently on health roster, and that will be live from the 1st of June. And that new timesheet system will be on a platform called Easy, and I think that's the one that we use for travel expenses, etc. And it'll be for substantively monthly paid staff to enter additional and unsocial hours, and that'll be done electronically rather than completing a paper claim form. And these will be authorised online and submitted to Pay Services automatically for payment. So no longer filling any forms in on paper. So there'll be no completion of those forms or scanning or emailing those forms across. So obviously there'll be a huge saving in time and efficiency in payment there. And that system, again, just to reiterate, will go live from the 1st of June and for those not currently on health roster, and it will be paid therefore go live in June, and the sort of first payment date that will be applied for to is July's pay run. In the chat we've posted, hopefully Lee, did you post the contact email address for any conversations, any information or updates or queries that you might have with Pay Services? We'll make sure that goes in the chat.
As many words, but the problems it caused.
Okay, and then hopefully that answers that question. And then there was a further question on the care certificate and how to complete that. So there's two ways care certificates. So they're both online. The Sherwood Academy holds all the sort of knowledge-based parts of that care certificate. So you can access that through the intranet. But to complete the care certificate in full, it's free, but you need to access the e-Learning for Health website. And anyone can access that, and as I said, it's for free. So hopefully that covers off that. So let's move to our first guest today. So Sally. So Sally's a regular, or was. I haven't seen her for a while actually. I think you've been keeping your head down recently, Sally. But Sally Palmer's been a regular contributor to staff briefs on all things COVID, face covering, IPC regulations and social distancing policy. And Sally's here to give an update on that. We've had a number of conversations about guidance that was issued about a month ago now and how it's been applied and implemented. So over to you, Sally.
Okay. Morning everyone, and thank you for having me today. So yes, just to update on where we are with the guidance and the implementation. So we have seen several changes over the last few months of the COVID guidance and the learning to live with COVID documents that have been coming out. So the first one that I wanted to look at was around masks. And we are continuing to wear masks across the organisation. So clinical areas, there's definitely no change, and masks are to be worn at all times in clinical areas still. And we are continuing that in our non-clinical areas at the moment. So I know some organisations have now changed their stance on that with regards to office areas. But there are some criteria that we need to be able to meet before we can implement any of that around social distancing, ventilation and things like that. So just for consistency at this moment in time, we are maintaining masks, and that is constantly under review, and we will be looking at what all our options are and how we can support in removal of masks going forward in the future. and we will keep you updated on that. But if I could just ask at this time, if you do maintain wearing your masks in clinical and non-clinical areas, please. On that, the other things that we're looking at is around so social distancing. We are still remaining at 1 metre in most areas, but we do need to maintain 2 metres in areas where we have our patients. So in our clinical inpatient areas, we have got a risk assessment in place for our outpatient areas to remain at 1 metre for that, and our non-clinical areas are all 1 metre distance now in line with the new guidance. The other things that have changed is around testing. So you will have seen some communications last week around COVID testing, and we no longer are doing PCR testing for our elective patients. We've moved to LFT testing and with national guidance, so patients will do an LFT before they come to us now, with regards to their treatments and where that's required. The inpatient testing, we're hoping to change that from next week. So we're looking at the national guidance says that we need to do a PCR or a point of care test on admission for all our patients, and then move to LFT testing for day 3 and day 5 to 7 testing going forward. So we're just looking at it. We're waiting for our supplies to come in of LFTs, and we're also looking at our reporting system for that. And training's going ahead, and the swab team will be supporting with doing that on the ward, so it won't be the ward staff that are expected to do those LFTs. The swab team will be there to do that and support with that and recording of those results. And the thing that we're looking at the moment is getting the results recorded on ICE, so all your results are still in the same place. So and we're hoping to move to that next week, but again we will keep you updated on the progress of that. And probably sort of non-COVID related, the other thing to mention that you will have seen in the news recently is around monkeypox. And just to assure you, we are working on our guidance for how to manage cases and possible cases if we do see them within the trust, and you will have a flow chart and some guidance out by the end of this week to give you the information around how to manage that. Thank you.
Thanks, Sally. Can I ask a question? And I know there's one in the chat from Claire Allison, but I'll cover mine first if I can. And that's the sort of connection between continuing to require face coverings and that distancing. And I'm aware that, as you mentioned this, that other organisations have been able to relax the requirement to wear a face covering, and I think that's because they can have greater distancing at a 2 metre range. Is that right? That's my understanding.
Yes. Yes, so the organisations that we spoke to are distancing to 2 metres, and then they're looking at areas where they've got really good ventilation in office areas, those areas as well.
Thank you. Thanks for that. It's good clarification. So to the question in the chat from Claire Allison, have there been any changes for pregnant members of staff who wish to continue to work beyond 28 weeks of pregnancy? Do they need to work from home still?
So there hasn't been any update to that guidance that we're aware of at this point. So they would still need to be working from home or outside of the clinical area at this point.
Okay, thank you. There was a question there on explaining the criteria able to stop wearing masks in non-clinical areas, but I think that's the 2 metre distance. If we're able to maintain good ventilation and 2 metre distance, so and for consistency at the moment, we're asking that because our non-clinical areas, we can assure ourselves on the 1 metre distance. For consistency, we can't continue with that, and I understand that is under continuous review.
It is, yes. So what we need to look at is around our ventilation in those areas. So we'll need to look at individual office spaces to see what ventilation they've got, if they've got access to windows, because some of our offices are very small, have no mechanical ventilation at all, and some of our office areas don't even have windows. So I think we're going to probably look at doing individual assessments of officers, but again, it's putting that process in place and making sure we've got those right risk assessments to be able to do that moving forward.
Okay, thank you. So we are thinking about that moving forward.
Yes.
It's getting the right process in place to have the right risk assess the risk in an appropriate way.
Yes. Yeah.
Brilliant, thank you. Okay, so I can't see any more questions in the chat so far for you, Sally. I'm sure that some will come through as we go. So if you could bear with us for the next sort of 10 minutes, and then we'll probably come back to you. Vicky, so congratulations on your appointment as head of culture and engagement. I know that's been a recent appointment, so congratulations for that. And you're here today to talk about how we're moving forward with what we've learned from what our staff have been saying to us in the National Staff Survey.
Yeah, absolutely. Thank you, Paul, and thank you everybody for inviting me along today. So I'm joining today just really to introduce you all to some of our commitment areas that we will be focusing on over, I say, the next 12 months, but of course we'll go beyond if the need is still there. We heard from over 3,400 staff in our staff survey last autumn, which was absolutely incredible. But the important bit, as always, is, well, what are you doing about what we've told you? So I just wanted to come along today and give a few updates on some of our plans for what we're going to be doing about some of what we've heard. We've tried to keep this quite simple, because what we don't want is big action plans. We want the action and not too much onerous documentation. So we're looking at 3 commitment areas to you as our colleagues in Sherwood, and they're around valuing you, caring about you, and developing you. And hopefully you'll be able to see those on the screen at the moment. Our plan is to come along every month and focus on one of these areas. So you'll see along the top there's a timeline of our plans to come along to Trust Brief, to join, to write into the bulletin, to have a chat with Paul about things he could include in his CEO blog, and just really make sure that we're keeping you informed along the way. And sometimes that might just be to say what we're working on. It may always not be that we've got answers to everything, but I think it's important for you all to know what we're working on, where we're at with things, and even more importantly, to give you all the opportunity to contribute to that. So I am always really happy in my own email address or via the OD inquiries inbox to hear any feedback you've got around any of these topics, or if anyone is particularly passionate and wants to help us drive improvement, we are always very welcome to join in any of our working groups. So on here, you'll see that valuing you, we're focusing on things like making sure actually there's enough people in the organisation to enable you to do your job properly. We have fantastic plans around recruitment and resourcing, and we'll be keeping you up to date on that along the way, including looking at some of the professional groups where perhaps we haven't done as much targeted focus before. So things like our admin professionals, we'll be looking at specific work around that workforce. We're also looking at improving colleagues' feelings of value and recognition. This came out really strongly, and I think what I've picked up on things like our Facebook group and some of the conversations I've had is we've lost some things during COVID. We've lost some of that personal touch to value and recognition, and I know there was quite a lot of conversation around how we really recognise the contribution of people who have had a lot of service here and then retire. So I just want to let everybody know that we've heard you around that, and we're looking at what we can do around that. And obviously all of that is intended to reduce the number of colleagues who may be looking for opportunities elsewhere outside of Sherwood. In terms of caring about you, we've got some really specific work we want to do here around colleague experience of violence and aggression. We sit as a bit of an outlier here as an organisation, so we are absolutely committed to working not just as an organisation but across the whole system to really make sure that our messaging around zero tolerance of violence and aggression towards our staff is there. We're also looking at how we reduce colleague experience of discrimination, particularly some of our EDI protected characteristic groups who we know have a different experience than some of their colleagues, and that variation in experience is just not something that we want at Sherwood. And generally, we have a really strong civility, respect and kindness programme of work here at Sherwood. So all about making sure that those colleague-to-colleague relationships are as good and positive and enabling as possible. And then finally looking at developing you. So a couple of really strong themes that came out of the survey were around appraisal conversations. So lots of people getting their appraisal, but then not reporting that it has either made them feel valued or helped them do their job better or given them clear objectives for their work moving forward. So we recognise there's a disconnect in that conversation, and we want to make sure that that time that you're spending on an appraisal conversation is giving you what you need. We're also looking at making sure that our career progression and development opportunities are fair and transparent. So some comments around feeling like it's a bit of who you know and not always what you know. And obviously we want to make sure that we engage colleagues in that conversation and reassure and have that transparency over our recruitment processes and our development opportunities. And then finally, some really specific work looking at developing our leaders and making sure that we've got talent management plans across all of our workforce and not just our senior colleagues. So there's some of the topics that we'll be looking at. Good news is it was all work that we had on our radar anyway. So that's really reassuring. Nothing has come sort of from the left wing around this. So it's all groups that we've already got established, work's already in progress, and we'll be coming along in June to talk specifically around our Valuing You commitment and some of the work that's going along that.
Great, thank you. Thank you, Vicky. So can I ask a question around appraisals?
Yeah.
So something that came through, and that's why it's on the slide clearly, and part of the Developing You theme was that part of that came through really strongly was many of our staff feel that the value of that appraisal, they don't really get much out of it. So is there anything you can share about the thinking around how we're responding to that?
So early days, but I think it's fair to say there's a couple of work streams looking at this. So one is about actually the paperwork that we've got. We've got quite a long process of paperwork at the moment, and having recently gone through my appraisal as someone new in the organisation, I found it tricky to find it in the first place. I wasn't sure which bits to necessarily fill in. So there's a piece of work really making sure that that paperwork is accessible and is understood and is adding value. So that's the sort of process side of it. And then there's a piece of work around actually the skills that someone conducting appraisal needs to bring the best out of the people that they're having that conversation with. So how do we make that a really good career strengths-based coaching conversation as well, and that might not always be in that appraisal conversation. So actually, what other offers do we have to our colleagues to make sure that those looking for progression or looking for development aren't restricted to that once a year conversation as part of their appraisal and have access to that support throughout the year. So that work is happening with our head of learning, Michael DeRose, and he's looking at that whole talent management piece of work to make sure that we are keeping our talent in Sherwood, which is absolutely what we want to be doing.
Great, thank you. I can't see any questions coming in the chat specifically around this. I know you covered this, but how will just remind me, how will everyone get updates on this through? So you've mentioned that there'd be trailing it here regularly, probably monthly at Staff Brief. There's, I know there'll be things that I cover in the blog, but how will there be other mechanisms where staff can, where people can not only understand progress, but you mentioned that you'd like to encourage people to get involved.
Yeah,
as well.
absolutely.
How will that happen?
Yeah, absolutely. So we'll make sure we're using the Facebook group, because I think that's a really good space that we have for people to contribute ideas and conversation. I'm always keeping an eye on what I can pick out of there that's important to staff at the moment. Always more than happy to have individual conversations with people who are passionate. We're going to try and use our Sherwood Voices blog to hear from people sort of on the receiving end of some of this progress. So, for example, if you've been on a brilliant or had a brilliant appraisal conversation and want to talk about that and why that was great and what that meant to you, we'd like to share some of those stories so that we can celebrate the good work that's happening as well. We're also working with the division, so I'll be going out over the next few weeks to talk to all the divisional triumvirates about actually how the work that they're doing in the divisions, but also how can we make sure we've got that really strong divisional voice in all of these pieces of work, because we really recognise this isn't something that us as corporate colleagues can sit and get all the answers to. We absolutely need the voices of the organisation involved. So lots of different mechanisms. I'm working really closely with our comms team to make sure that we are giving you that feedback along the way. I think it's really important that people understand that you've been heard, but also that we are actively really working on some of these hot topics that have probably been hot topics for a number of years, some of them.
Thank you. Okay, so I'm just trying to cover off questions in the chat, sort of give some sort of order. So there's one or two for you, Sally, as you might expect. So if I could just turn back to you then, Sally. So the question that I can see in front of me, following on from earlier comments, re staff working in non-ventilated or windowless offices, is it safe for us still to be working in these areas following the pandemic?
Yes, it is still safe. It's just it's around why we have still got COVID circulating, and we know that, you know, we've still got inpatients and things. We just need to make it as safe as possible, which is why we're keeping the masks, because we're still seeing other respiratory viruses as well. So we're still seeing influenza around, RSV. So it's just making sure we've got those assessments, but it's definitely still safe to work in there, and like I say, keeping the masks on. And if we could distance to 2 meters, we would be able to take, you know, potentially take those off going forwards. But it's just, we just want to make sure we've got the safest environment. But yes, the officers are safe. We do sort of still recommend that you're still cleaning your desks and your high touch surfaces with your Clinell wipes on a regular basis, and doing your hand hygiene as well to support with reducing those infections. But we are still seeing the winter respiratory viruses that we probably would be seeing the end of now. We are still seeing a number of those at the moment.
Okay, thank you. And just following the theme of keeping and undertaking those risk assessments that we described earlier, there's a question about as we are having to continue wearing masks, can we have the number of occupants re-evaluated? And I think that comes into that risk assessment that we described, that we're looking to put into place and implement in the future. Yeah, absolutely, it does. So we can do that as if people want to get in touch with us for individual office reviews at the moment, we're happy to come and support with that. Thank you. Questions come in prompted by your mention of Clinell wipes and asking where they can be sourced. So through procurement, if you contact the procurement team, they'll be able to source them for you. The number is 4242 for the procurement helpline. Thank you. Good knowledge as well. Good knowledge. Used it a lot. Thank you. So just thinking about questions on other topics. So we've had some interest in the care certificate. So reminding me that is there's two parts to that. There's the knowledge part of it that can be accessed by the Sherwood Academy, but there's also a competency based aspect to it. And quite helpfully, we've received a prompt from Eleanor, I think it is, in the learning development team to give. I'm just trying to search, can't find the telephone number. So the extension number to ring for help in order to actually register and complete the full care certificate, including the two parts, which includes the practical and the e-learning, to ring 4424. And Eleanor will talk you through it. So thanks, Eleanor, for giving us that update. And I think I have covered questions that have come in. So if you've got any final questions, then please place them in the chat. Just thinking about the updates on this staff brief in the future, Sally, I guess that as and when any of our implementation of the guidance change and our approach changes, indeed in respect of risk assessments, we will then be announcing those and hopefully talking them through in this staff brief at the same time. Yeah, absolutely. Okay, great.
There's just one question there, Paul, about staff survey, if you want me to just dip in on that.
Yeah.
So there's a question around, will managers be able to see the comments from the staff survey in order to put into context some of the scores? Otherwise, it's a pointless exercise. We do get a number of free text comments as part of the survey. We had about 400 as part of the survey. Those are broken down into division and divisional leadership teams, and the HR business partners for those teams have had those free text comments. We don't break them down into individual team levels for all the reasons that we talked about previously around protecting anonymity and making sure that colleagues feel that it is an exercise where they can speak up. So if anybody wants to get in touch individually with me, I'm more than happy to have a further conversation around what you might be looking for. But the short answer is that those comments aren't available at a team level.
Thanks for that clarification. And a further question about procurement and access to Clinell wipes and Graskin Mill procurement supply wipes to non-clinical areas who do not have a regular stock delivery. But I think the answer to that is an overwhelming yes, and that has continued through this process.
Yeah, absolutely, and they can support with getting a stock delivery if needed as well.
Great, thank you. Okay. I think that's all the questions that we've had through. So thanks everyone for joining us today. Thank you to Sally and Vicky for their updates. Really important on both those areas. So important that we remain vigilant and compliant in all aspects of infection prevention control, and also really important that we communicate on how the organisation is responding to what everyone's told us about how it feels to work here through the staff survey, and hopefully you're getting a sense of how we're responding to that, and we're responding in the areas that have been provided with through that data and with your feedback. So thank you to both of you for today. Hope everyone enjoys the rest of the week. For those of you attending football matches over this weekend, be very careful. Sally's a little bit nervous about super spreader events that might take place at Wembley at the weekend, so please be vigilant there as well, and have a great week and weekend. So thanks everyone. See you soon.
Thank you. Bye bye.
Thanks.